We just got some sad news. The American College of Emergency Physicians just announced the passing of the first ER doctor from COVID-19. He was a doctor in New Jersey. So now I turn to a couple of doctors at the front line of this coronavirus fight. Joining me now is Dr. Megan Ranney, an emergency room physician and associate professor of emergency medicine at Brown University, and Dr. Daniela Lamas, a pulmonary and critical care doctor at Brigham and Women's Hospital in Boston. Doctors, I don't think either one of you knew that news before we just reported it. This just got reported. And Dr. Ranney, this is the nightmare that so many of you and others in the medical community have been concerned about, which is the protection of medical personnel on the front lines fighting this virus.
That is exactly right. Many of us in the emergency medicine community knew the man who we knew was in the intensive care unit in New Jersey. He was a leader within the emergency medicine field. And I didn't know it before you just said it. It breaks my heart. I hope he is the first of only a few emergency physicians to die. But if Italy and China are any guide, unless our government steps up and gets us the protective equipment that we need, he will be the first of many of my colleagues to succumb to COVID-19.
Tell me what's missing right now. Dr. Ranney, I'm sorry to be the one to break this news to you. This is not my place to do that. I know he's a friend of and colleague of yours. But tell me the equipment. Just reiterate again for folks to understand. What is it that you guys need right now that the federal government has to be the one to procure?
Absolutely. So let me make a very long list of things that we need. We need masks, regular procedural masks. We need N95 masks. We need gloves, gowns, hand sanitizer. We also are increasingly running out of durable medical equipment. Things like the disposable blades that we use when we intubate patients. Things like the spacers that we use for albuterol, for those pumps, for inhalers. We're also running out, of course, of ventilators and non-invasive positive pressure ventilation machines. And we're starting to run out of critical medications. The medications that we give patients to put them into a medical coma when we intubate them are running low in many centers in New York City, as well as in many of the other hard-hit areas across the country. So really, if you name a type of equipment that is essential to critical care and to emergency response, we're running low on it.
Hello, YouTubers. If you're watching this, it means you've checked out our channel, so thank you. Now do me a favor, subscribe by clicking on that button down there. Click on any of the videos to watch the latest interviews and highlights from MTP Daily and MSNBC. You can get more Meet the Press content every morning in the First Read newsletter. If you're tired of content that you don't know anything about where it came from, you don't have to have that problem with us. NBC News, MSNBC, MTP, and the Meet the Press mindset right here for you on YouTube. Subscribe now.